Hello, welcome. In this video, we will look at FNAC. FNAC means Fine Needle Aspiration Cytology, that is the study of cells. So how are you retrieving the cells to study? By fine needle aspiration. You're going to put a fine needle, aspirate the cells and then study the cells. That is cytology. So fine needle aspiration cytology. So why should you read this or watch this video? Because it is used a lot. It is a very important diagnostic technique and it is important for exam, correct? That's why we should know about fine needle aspiration cytology. Now, what are the questions asked about FNAC in the exam? They ask what is fine needle aspiration cytology, what are the indications for FNAC, what are the advantages of FNAC, what is the significance, the role in pathological diagnosis. These are the questions usually that are asked in the exam. Okay, so let's move on now. First of all, let us understand where we are in the whole picture of diagnostic cytology, where we are. See, there are numerous cytodiagnostic techniques. Okay, why would you do them? You would do them to diagnose tumors. You want to check whether it is a malignant or a benign tumor. So that is when you need a cytology, because you know that microscopic examination is the gold standard for cancer diagnosis, correct? So, to diagnose tumors, benign, malignant, you want to distinguish. Then in non-neoplastic conditions, basically you want to check the infectious condition, the inflammation you want to check. Cytogenetics, you want to study the genetics of these cells. That time also you need the cells. So how will you get the cells? By fine needle aspiration. And also you can assess the hormonal status in women. That's what they are saying here. So basically diagnostic cytology, these are the numerous applications. Okay. So people, we are studying about FNAC. We have seen overall in the diagnostic cytology why they do diagnostic cytology. Okay. Now, let us look at the available methods, okay, in diagnostic cytology. You have exfoliative and interventional. That means you're intervening. That is interventional. In exfoliative, you have something like pap smear. This is the pap smear kit. So, in exfoliative, you have the pap smear like for endometrium, right? They will check the stage of the endometrium. Luteal phase, secretory phase, all that, for all that you can use pap smear. To rule out cervical cancer, correct? They will use pap smear. Coming to interventional, that means you're intervening. See, there's a needle here. So you have fine needle aspiration cytology, you have imprint cytology, crush smear cytology, and you have biopsy sediment cytology. So there are 4 interventional cytology. Yes, you have FNAC, imprint cytology, crush smear cytology and biopsy sediment cytology. We are currently looking at FNAC, right? That is what we want to focus in this video. So just a fine needle going and retrieving some cells from our body, and then they will be examined by the histopathologist and they will tell what exactly is the situation of these cells. So that is fine needle aspiration cytology. What do you think is imprint cytology? Imprint cytology, the cut section, it still will be imprinted onto something. That is imprint cytology. Crush smear cytology in brain tumor. So crushed smear. Biopsy sediment cytology, usually in bone tumor, they will use the sediment cytology, biopsy sediment cytology. Okay, so you understand exactly where FNAC is as of now, right? So FNAC is in the bigger picture, it is in the interventional cytology under the diagnostic cytology, right? Interventional under the diagnostic cytology. So FNAC, we will come to the details. Before that, just let's have a word on the other imprint cytology. This is the diagram for imprint cytology. Then you have crush smear from brain tumor, for brain tumor. Then biopsy sediment cytology for bone tumor. Okay. So these at least names you should know. So coming to FNAC. FNAC basically, what is it? It is a versatile procedure. You can use it for almost all organ systems which are accessible to the fine needle. Okay. So this is the fine needle. In this actually you can see 2 parts. This is the needle and this is the syringe, correct? So sometimes they just put the needle and by capillary action they can retrieve the cells. So you don't need a syringe for suction at all sometimes. Okay. Once they retrieve these cells, then they will put it onto these slides, and some slides are using the stain like PAP stain and H&E stain, that is Papa Nicolau stain and H&E stain. They will use stains. The other stains usually are, other slides are air dried, and they are also stained with Ramanowski stains, okay, like MGG stain. So basically they are stained and then they are examined, probably under the microscope, right? You need microscopic view. You examine them and then you will give a diagnosis as to how it looks. Either it is benign or malignant, or what is the kind of inflammation, hormonal status, genetic study you can do, right? Now, let's just go line by line here. So, here FNAC, they are saying you need a syringe, you need a well-fitting needle for the syringe holder you can use like Franzen handle. Franzen handle is shown here in the diagram previously. This is the handle, Franzen handle. This is the Franzen handle, okay, to hold the syringe. That is a syringe holder. Okay, so you have the, where are we, Franzen handle we finished, right? Just highlight some words like this, Franzen handle. Then you will use some slides, microscopic slides, and you will use stains and fixative materials, okay. Now, half the slides are wet fixed. They are used for staining. Which staining? Papa Nicolau stain and H&E stain. So, you will use the PAP stain and the H&E stain. That is Papa Nicolau stain and H&E stain. The remaining stains you will use Ramanowski stains such as MGG, okay. Now, what are the advantages of FNAC? It is an OPD procedure. Nice. OPD procedure. No need to admit the patient. No anesthesia is required. Okay. No anesthesia is required. It is quick. It is safe. It is least painful and cost effective. Least painful. Least painful. They didn't say painless. They said least painful. This is kind of more relatable. If they say painless, I really don't believe them. So least painful is better. It is cost effective. Okay, it is cost effective. That's also a nice thing, right? It is cost effective. It is cost effective. Then, and you can do multiple attempts. These are the major advantages of FNAC. Now, deep-seated organs, you may need a longer needle and you'll also need guidance by ultrasound, CT, etc. Okay. So, this is a very brief overview of FNAC. We need to go to the details of FNAC. Okay. We need to look at the applications in detail. We need to look at the advantages in details. We need to look at the procedure. In procedure, what are the materials needed like needle, syringe holder, slides, fixatives, stains. So you need all the materials. Then the method of aspiration. We'll come to this one, method of aspiration. How you'll prepare the smears and what ancillary and special studies you will do. Complications and hazards also we have to look at. That it can result in hematomas, infections, pneumothorax, dissemination of tumor. So these are the complications and hazards. Precautions and contraindications. So if a person has bleeding disorder, you should be very careful. In liver FNAC, you should be very careful. One second. This in liver FNAC, the prothrombin time you should know. And it is not at all advisable, FNAC is not at all advisable if prothrombin index is less than 80%, okay. Obstructive jaundice is also a contraindication for FNAC. Then coming to lung FNAC, you should not do it in elderly patients with emphysema or pulmonary hypertension because there is increased risk of pneumothorax and hemoptysis. Pancreas FNAC, FNAC of pancreas is contradicted if there is acute pancreatitis. Okay? Because it aggravates the inflammatory process. Prostate transrectal aspiration in acute prostatitis may cause bacteremia, septicemia and is contraindicated. So, contraindicated prostate FNAC is contraindicated in acute prostatitis. Okay. Because it can lead to bacteremia, septicemia and it is contraindicated. This transrectal aspiration is contraindicated. Transrectal FNAC is contraindicated in acute prostatitis. Transrectal aspiration is contraindicated because if you're going rectal route, I think you will be introducing bacteria. Testis aspiration is extremely painful, okay, in acute epididymoorchitis. Okay, in epididymoorchitis, it is extremely painful and you should defer it till the inflammation, subsides. So, testis FNAC, extremely painful in acute epididymoorchitis. Okay. So, wait till, or you defer, wait means they'll wait 1 hour and sit. Defer till inflammation subsides. Okay. So, you should give that person anti-inflammatory agents, antibiotics, and then you should do FNAC on a later date. So, moving on, adrenal FNAC also has some contraindication. Adrenal FNAC of suspected pheochromocytoma is inadvisable as it sometimes provokes extreme fluctuations in blood pressure. So, FNAC of adrenal gland is inadvisable in suspected pheochromocytoma, right? Because it can lead to extreme fluctuations in blood pressure. See, pheochromocytoma, what will be the clinical condition? Blood pressure, right? Blood pressure itself is the condition and this is a surgically correctable blood pressure in pheochromocytoma. So, in that case, don't do FNAC of the adrenal gland because there can be extreme fluctuations in blood pressure. So, these are the precautions and contraindications of FNAC. Then we have to look at some cytologic diagnosis. Some heading is there like this. Let's see if we will cover it. Coming to limitations of FNAC, basically the only word they have written here is only small sample can be retrieved. So when you are retrieving a very small sample, you may not get the full picture. It may always lead to false negative. False negative means the portion that you retrieve may be perfectly fine. So it may lead to a false negative. Correct? So if you are doubtful that the clinical condition looks like it is definitely something, then you repeat the FNAC. And exact site you should be doing it correctly. When you do it the exact site, right, you will get the correct picture. So these are the limitations of FNAC. So in this video, we just started off with the FNAC lecture. There is a lot details we have to go because in the exam you can't just write this much. You have to write finer points, correct? So for finer points, you have to watch finer videos. For now, just look at this much. So we are currently in the interventional diagnostic cytology where you have FNAC. Other than that, you have imprint cytology, crush smear cytology, biopsy, sediment cytology, etc. In FNAC, basically what is done, it is what and all you need, needle, syringe holder, like the Franzen handle if you want, you can use microscopic slides. Obviously, you need the microscope, you need the stains like Papanicolaou stain and the H&E stain. You need the Romanowski stain like MGG. And then the listed advantages here, it's an OPD procedure, no anesthesia required, it is quick and safe. It's quick, it's safe, It's least painful, cost effective, and you can do multiple attempts. Can you see these advantages without looking at this? Because you have to write the advantages in the exam. And tuck, 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 it should come to your brain. See? It is cost effective, it is done as OPD procedure, no anesthesia required, it is quick, it is safe, it is least painful, and you can repeat the number of attempts. Okay. Then deep-seated organs may need the guidance via ultrasound, CT, etc. Okay, right? Then we will further look at all the details, okay, but for now just focus on this thing. Standard 21 gauge disposable needle of 38 millimeter length is suitable for routine transcutaneous FNAC of palpable mass. This much you remember for now, because these are all very basic things you should know. The standard 21 gauge disposable needle. This is a disposable needle which is 38 millimeter in length. So in your hand, just measure 3.8 centimeter. 3.8 centimeter in length, almost 4 centimeter in length it will be. So this is a 21 gauge. 21 gauge means what? The diameter, outer diameter will be around 0.7 millimeter maybe, right? So 0.7 millimeter diameter it will be, and it will be almost 4 centimeter in length. This is a 21 gauge disposable needle. 21, you remember, this is standard 21 gauge disposable needle, is used for routine transcutaneous FNAC for palpable masses. Okay. Complications and hazards, you yourself may introduce hematomas, infections, pneumothorax, dissemination of tumor, you may only do. So these are the bad things. Precautions and contraindications of FNAC. So if the person has bleeding disorders, be careful. If the person has obstructive jaundice, be careful. If the person has less prothrombin time, you should be careful, correct? It's more like if the prothrombin index is less than 80%, then it is contraindicated, okay? So just pay attention again here. Bleeding disorders like hemophilia, thrombocytopenia, what will happen? It is not fully contraindicated, but superficial lesions you can aspirate, but deep may be contraindicated in hemophilia, etc. So superficial lesions you can aspirate, and once you are removing the needle, you should apply pressure for 5 minutes at the puncture site so that you will stop the bleeding. Okay. Then liver FNAC we already saw, it is contraindicated if prothrombin index PTI is less than 80%. Obstructive jaundice also contraindicated. Lung FNAC, you should not do lung FNAC in elderly people with emphysema, pulmonary hypertension, etc. because you can have increased risk of pneumothorax, hemoptysis, etc. Pancreas FNAC you should not do if there is acute pancreatitis. Prostate FNAC you should not do if there is you should not do transrectal aspiration, okay, if there is acute prostatitis. Testis, if there is acute epididymoorchitis, then don't do FNAC because it will be extremely painful. So you defer till the inflammation of the testis, acute epididymoorchitis, till it subsides, you wait. Adrenal FNAC, it is not at all advised if you have, if a person is suspected of having pheochromocytoma, because there can be extreme fluctuations in blood pressure. Limitations of FNAC, only small sample you can get and it can give false negative because you may get a very clear picture, but actual clinical picture may not be fully clear. So based on the clinical features, you may repeat the FNAC if you are doubtful. Also you can the thing is exact site only if you know, then only FNAC is going to be giving a clear picture. Okay. So guys, this was about FNAC, that is fine needle aspiration cytology. This is a diagnostic cytology. Okay. See you, and I hope you enjoyed this video. Bye bye.